So I'm really excited to be here. I was just thinking, we have been in the Northwest. I think this is our 11th year. And we have scanned thousands of people. The Northwest, always has very interesting brains. There are brains with sun and brains without sun.
Can you tell the difference?
But some of the most forward-thinking, sweetest, kindest people I know. It's because of all the coffee you have. But so tonight I'm going to tell you a little bit about what we do, but how we came to the fact that ADD is clearly not one thing. It's like, we need to stop this. ADD is skyrocketing in the population. 20% of children have been diagnosed with it. It's way too high. It's probably twice as many as should be. There was an article in USA Today, if you don't have ADD, is it cheating if you take Adderall? And the answer is yes, it is cheating. It will help you short term, but it can also have some pretty severe side effects if you don't have ADD. I'm a child psychiatrist by training, so I'm a general psychiatrist. I did that first at the Walter Reed Army Medical Center. And then I got specialty training in child psychiatry, mostly to deal with my own children. But I love that. Even if you never see children, being a child psychiatrist is of benefit because so many developmental issues that you live with as an adult actually happened in childhood. So understanding that is really important. I did my training in the Army. I was an Army officer for 7 years. And my last duty assignment was a place called Fort Irwin. Anybody know where Fort Irwin is? It's in the middle of the Mojave Desert. It's 40 miles north of nowhere. So there's this little city called Barstow, and you have to go 40 miles north of Barstow. And I was the only psychiatrist for about 10,000 people. It was a very stressful place. And while I was there, I learned about a technique called biofeedback and then neurofeedback. Anybody here do neurofeedback? It's very powerful. Actually, recently just got A-level scientific evidence from the American Academy of Pediatrics is one of the potential treatments for ADD. And it was through learning how to change people's brain waves that I became very interested in brain SPECT imaging. SPECT is a nuclear medicine study, looks at blood flow and activity, looks at how the brain works. And so being a child psychiatrist, my very first patient who I'll tell you about, I knew she had ADD, but she wouldn't take her treatment. And so then I scanned her, classic ADD. And what happened was the pictures completely changed her mindset about what was going on with her. She took the treatment, got a radical improvement. But I saw, as I scanned hundreds of ADD people, it wasn't one thing in the brain. And the people who were made worse by Ritalin and other medications like Ritalin had a very different brain than the people who got better on Ritalin. And I couldn't tell clinically. Psychiatrists, we are the only medical doctors that never look at the organ we treat. Think about that. Cardiologists look, orthopedic doctors look, neurologists look, gastroenterologists look, everybody else looks, we guess. And is that because we're smarter? I don't think so. Is it because we're more intuitive? Probably not. And I've been criticized, actually, a fair bit over the years, but I don't really care. Because if you don't look, how do you know? And it reminds me, anybody remember Johnny Carson? And Karnak the Magnificent?
Yes.
The answer is. And that's what I feel like my profession does. It's, well, let me guess, based on your symptom clusters, who acts like that? Right? I mean, if your car is smoking, stalling, using too much gas, and you take it to the mechanic, and the mechanic listens to the history, and then he puts his hand on the hood, and goes, it's your air filter. How would you trust him if he didn't pop the hood and try to actually look at how the engine worked? Would you trust him? Personally, I wouldn't trust him. And that's why we have not changed stigma in psychiatry in the 32 years I've been a psychiatrist. We've not changed it one bit. Who wants to see a psychiatrist? Who wakes up in the morning and go, this is going to be a fun day? Nobody wants to see a psychiatrist, and nobody wants to have a psychiatric illness. Who wants to be mentally ill in this room? Nobody, right? But don't you all want a better brain?
Yeah.
Everybody who's intelligent wants a better brain, right? So the images are really powerful. So right away I learned that ADD is not one thing. And I wrote a book about it called Healing ADD about 13 years ago. And then I just recently revised it. It came out in December because I added a 7th type. And you really had to hold me back from not adding an 8th type. And the 8th type would be head trauma-induced ADD. But it's really not ADD. It's you have a frontal lobe disorder secondary to your mother lets you play football. Brand new study out this week. If you play football and you never have a concussion, you still have damage to the hippocampus, the major memory structure in your brain. It's just not a good thing. So, Microsoft, they're just down the corner, aren't they? They're still trying to get me. Let's not do this now. Thank you. So, SPECT, again, is a nuclear medicine study that looks at blood flow and activity. You'll see our cameras. They happen to be the best brain imaging cameras in the world. They were developed in the early 90s. When they did the next versions, they actually made them worse, because what they did was they made them all-purpose scanners as opposed to scanners dedicated to small organs like your brain. So they have 3 heads on them. The heads can get close to the brain, which means we can get really beautiful pictures of brain function. And SPECT basically tells you 3 things. Good activity in the brain, too little or too much, not hard. The image on the left is looking at the outside surface of the brain. The top is the front part. The bottom is the back. This is the cerebellum. These are the temporal lobes. It doesn't flash on there. That's so interesting. It's like a ghost. It's not real. So the top is the frontal lobes, and here we're looking, again, looking down from the top, the back is the cerebellum. Typically, it's the most active part of the brain because it has half the brain's neurons. So even though it's only 10% of the brain's volume, it has half the brain's neurons. And one of the big lessons, like in the top 10, the cerebellum is so important and completely disrespected. And that is why doing coordination exercises, the cerebellum's involved in coordination, can actually make your mind work better. Dancing, tennis, table tennis. See, I think table tennis is the world's best sport. I played in the U.S. national table tennis tournament in 1999. Not one brain injury. But if you activate the cerebellum, it has connections and totally turns on your frontal lobes. This is why horse therapy works for autistic kids, because autistic kids usually have small or under-functioning cerebellum. And when you're on a horse, you have to balance yourself. You have to activate your core. And we have seen some tremendous results. Now, of course, if the horse has brain damage and it throws you off, what killed Superman? It was a horse. So you have to be very cautious and thoughtful and careful. We actually work with the National Jockey Association, and jockeys do not have good brains because they have a lot of head trauma, right? Okay, so this is healthy. almost immediately, so 1991, we started our imaging work, and I'm so excited. I want to find the one pattern for ADD and the one pattern for depression and bipolar disorder and schizophrenia, and I was so disappointed. Because what I realized, none of them are single or simple disorders. They all have multiple types. And without looking, I couldn't tell. So I became a huge advocate for imaging. So for example, let's take these two people who have ADD. And just so you know, I'll use the term ADD, and I use it when I write, and I often explain why I hate the term ADHD. It's a bad term, it's a mistake, and the American Psychiatric Association is made up of mostly men, and they couldn't say sorry for making the mistake. So ADD, Attention Deficit Disorder, was the term with the DSM-3 that came out in 1980, which is when I was training. And 1987, they changed it to ADHD. So it went to Attention Deficit Hyperactivity Disorder. And I raised my hand and said, well, that's really stupid. Because half the people who have ADD are never hyperactive. So why would you take a symptom that half the people don't have and make it part of its name? And there was an outcry among the rational. And in 1994, when they went to DSM-4, they changed the name of it to AD/HD. Now what the hell does that mean? It means half the people have it are never hyperactive. Well, why don't you just call them ADD? Because they all have attentional issues. And anyways, so I'm stubborn, it's true. We call it ADD. So one has really low activity, one has really high activity. They both meet all the criteria for ADD. Do you think they'll respond to the same treatment? No. This one's likely to get better on a stimulant. This one's likely to become suicidal on a stimulant. Why would you ever stimulate an overactive brain? Now, how does that make any sense at all? So that actually turned out to be our ring of fire type. So here are the 7 types that we're going to talk about and a little history behind them. The first, we have a few neurotransmitters we'll talk about, because I'll give you the treatment plan for each type. And then, yes, you can have, I go through the types and you're like, this type and that type and this type and that type too. People can have more than one type. So we think of dopamine, which is a I keep trying to do this. A stimulating neurotransmitter involved in focus and motivation. Serotonin, which actually calms your brain. So don't worry, be happy neurotransmitter. And GABA, another one that calms the brain. All right, classic ADD. It's what you think of when you think of ADD. Now here are the symptoms for those of you who are wondering whether or not you have ADD. Short attention span. But not for everything. That's the thing that fools people who have ADD. It's like, well, I don't have ADD. I can pay attention if I'm interested. When George Bush said that, because he didn't do that well in college, and he said, well, I could pay it if I was I'm like, not 2 ADD presidents in a row. And also, people with ADD, they don't get the words right. They'll mix them up when they're talking. So something about gynecologists making love with their patients. It's like, he didn't really say that. Okay, so it's short attention span for regular, routine, everyday things like homework, schoolwork, paperwork, chores, the things that make life work. For things that are new, novel, highly stimulating or frightening, people with ADD can pay attention just fine. So things that have their own intrinsic dopamine levels. And that's what fools them, because teenagers go, if I'm interested and I can concentrate. And typically when you look at their report card, they've got 1 or 2 A's and 1 or 2 F's. So the A's are the things, either they had a hot teacher or they had one that was really engaging and they could focus, and then they had boring teachers or things that they were not interested in. So really ADD should almost be called erratic attention disorder. They need love in order to focus. And when they fall in love, they can pay attention just fine for about 2 months. because love is a drug. Remember the last time you fell in love? Oh my God, all I could do is think about her, and I'm like calling her and texting her and over. And then the relationship becomes more regular, more routine. And then it's like, well, what happened? Now you can't pay attention at all. They're easily distracted. So most of us, what's beautiful about the human brain is it can block out things you don't need to pay attention to. So for example, this morning at about 7:30, I put on my shoes and my socks, and I've actually not thought about them until this moment. But if I bring my attention to my feet, I can totally feel the socks on my feet and the shoes. But I don't need to pay attention to that, so my brain blocks it out. People have ADD, they can't do that. So they are sensitive to noise, to light, to touch. Their clothes have to be just right. And when they're little kids, their parents worry that they're going to work at these special dance clubs because they take their clothes off all the time. They just take their clothes off, just take their clothes. And tags, it just drives them crazy. In fact, I've been married twice. My first wife had ADD. And right after we got married, I walked into my closet and I was going to get a shirt. And somebody cut the tag out of my shirt and had like a little rip in the shirt. And I'm feeling violated. And then I went to all of the other shirts in my closet and all the tags were gone. And I took the shirt, took it out into the living room, and I'm like, do you have any idea what happened to my shirt? She said, you had tags in everything. I couldn't believe it. I hate tags. Don't you hate them? And I'm like, sweetheart, I've never felt a tag in my life. Before you go cut up my clothes, do you think you could ask if it would be okay? I was feeling violated. I knew it wasn't going to be well. They tend to have problems with organization, their rooms, their desks, their book bags, their filing cabinets. You remember the Peanuts cartoon? You remember Pigpen, where the dirt would follow him? That's sort of how it is for many people who have ADD. They tend to be late. In fact, they actually don't start getting ready to go until they're late. Because what they need in their head is, oh my God, I'm late, in order to get ready. So they have a low dopamine state. They actually have slower heart rates, lower sweat gland activity, and lower frontal lobe function. So it's like they need to be upset in order to get anything done. And along with that becomes excitement-seeking, conflict-driven behavior. So living with them can be stressful. You need a meditation program in the family. Procrastination, they put things off until someone's mad at them. Basically, they won't do anything until someone threatens their life. I need this report by 5. It'll come in at 5:10. And then you have to go, look, next time it comes in after 5 at all, you're fired. Then it'll come in because you have to raise their level of anxiety. And they have issues with impulse control, which means they say the first thing that comes into their mind. How many of you are married? Is it helpful for you to say everything you think in your marriage? Of course not. Relationships require tact, forethought. Honey, how do I look in this skirt? Like the back of a school bus, one of my patients said to his wife. I'm like, I just don't think that's helpful. I mean, better to say, I like the other skirt better, and they tend to be restless and hyperactive. So they don't really like movies because they can't sit still. And if you're a partner to a classic ADD person all the time during the movie, what'd they say? What'd they say? What'd they say? Because they got distracted. All right. So 1991, it's April. I am the director of a dual diagnosis unit, psychiatric hospital unit that takes care of drug addicts. I go to grand rounds, and the grand rounds of my hospital is on brain SPECT imaging. And I'm so excited. I'm like, well, how cool. I like to look. I think looking is absolutely essential. And so they taught us about this tool, and I get it, because I'd already been doing neurofeedback and another study called quantitative EEG. And so I'm very excited. I walk out of the lecture into Sally's hospital room. Sally is 40 years old. Sally tried to kill herself the night before. Sally was very bright. She had an IQ of 144, but she never finished even 1 year at school, in college. She had an 8-year-old son that had ADD. So now I'm beginning to put together the puzzle. I think she has ADD. But as I start to talk to her, she's like, adults don't have ADD, I don't have ADD, don't talk to me about ADD. And I'm like, how do you know adults don't have ADD? We were just starting to think about that. And so, but I felt the pushback. And I said, well, would it be okay if I looked at your brain? And she said, okay. And I knew I had to do it twice. Once at rest, once while she concentrated, because I needed a comparison. That's what we found with our quantitative EEG work. The ADD brain at rest was okay. It's when we tried to get them to do things that it turned off. And so, notice, one, patient had no problem with the procedure. Please get more information before you label me and want to change my brain. And it was really helpful. So the image on the left is her brain at rest. The image on the right is when she tried to concentrate. And when she tried to concentrate, the front part of her brain dropped. So what does that mean? It means the harder she tries, the worse it gets. So I put them on her hospital table in a room. And as I explain them to her, she starts to cry. And she said, you mean it's not my fault? So what's that worth? And I said, you know, having ADD is just like people who need glasses. And I wear glasses to drive, and I put them out of my pocket and put them on my head. And I said, you know, people who need glasses aren't dumb, crazy, or stupid. Our eyeballs are shaped funny, and we wear glasses to focus. I said, people have ADD, they're not dumb, crazy, or stupid. Their frontal lobes turn off when they should turn on, and you need help to focus. She immediately got it. There was no more fussing about, I have it, I don't have it. She took the treatment, and on treatment, radically better. I'm so excited, because I knew the pictures mattered. Because they're an immediate representation of her brain. So not a group of people's brains, her brain. And she develops this concept I call brain envy. She wanted a better brain. Freud was totally wrong about envy. He picked the wrong organ. It's your brain where size really does matter. So how do we treat this type? We boost dopamine. How could you do that? Well, either stimulating supplements. We make one called Focus and Energy that has rhodiola and ginseng. It's wonderful. I think of it as soft Ritalin. Or you can use Ritalin, or you can use Adderall. They work for this type. In fact, it can be a miracle. It works so well. But we also found that exercise works. And a low, simple carbohydrate, high fiber, high protein diet. So the diet really does matter. In fact, it's the exact opposite of the standard American diet. So think of a plate, 70% plant-based foods, 30% high-quality protein. And you get rid of the things that turn to sugar. Because what sugar does is boost serotonin in the brain. So sugar and foods that quickly turn to sugar, bread, pasta, potatoes, rice, sugar, boost insulin, which then supercharges the amino acid tryptophan, which is the building block for serotonin, supercharges it into the brain. And so what do we give? So this type of ADD is a low dopamine state. So what do we typically feed children in the morning?
Cereal.
Cereal, which is full of sugar, or with foods that quickly turn to sugar. Or we give them Pop-Tarts, or donuts, or pastries, or waffles, or pancakes with liquid sugar, syrup. And then we have them wait for about 40 minutes until school starts. Then we go, concentrate. Now, I don't know about you, but if I went to the donut shop and had 2 or 3 donuts, I know exactly how I would be feeling 30 minutes later. Like my brain was in mud. But we typically do that to kids. That in fact, the diet I had growing up was better for my brain. That I had scrambled eggs and bacon. And even though I'm not a big fan of the nitrates in bacon, it's better than simple carbohydrate, low fiber, no fat breakfast. Never let anybody put you on a low fat diet. 60% of the solid weight of your brain is fat. Somebody calls you a fathead, say thank you. Low fat diets are bad for you. We know low levels of cholesterol are associated with autism, homicide, suicide, and depression. You don't want your cholesterol under 160 because cholesterol is the mother hormone. It helps make all the other hormones in your body. Omega-3 fatty acids, we are basically on an omega-3 deficient diet because all of the processed foods have omega-6s, which are pro-inflammatory, where omega-3 fatty acids are anti-inflammatory. Omega-6 fats, so think corn, soy, vegetable oil, boost inflammation, and they're called fall fats because they kill you early, where omega-3s, so salmon, tuna, avocados, walnuts, green leafy vegetables, are spring fats because they're anti-inflammatory and they give you energy. And DHA, so if you think of omega-3 fatty acids in fish oil, and it's broken down to a couple of different types, but primarily EPA and DHA. A lot of people think DHA brain, but it doesn't work for depression or ADD. According to the number of studies that's been done, it's EPA that works. And people think, but EPA is more for your heart. Well, guess what? Your brain uses 20% of the blood flow in your body. Anything that's good for your heart is good for your brain. So I have to tell you, after Sally, I'm beginning to get hooked on imaging. It's like, well, I have more information. And I had no financial interest in imaging for the first 4 years. I just loved it. I thought I was a better doctor. And that's the thing that gets me happy, if I can't get my patients well. So the next type is what we call inattentive ADD. And what we see, they have trouble focusing, but they're not hyperactive or impulsive, so they tend not to get diagnosed. They tend to be more introverted, so they're not a pain in the neck, and so they don't bring negative attention to themselves. More common in girls, and there is still serious gender bias in our society. So if a little boy is having trouble, people get really upset because they know he's going to have to take care of a family someday. And if a little girl is having trouble, they sort of hope she marries somebody nice, which is totally irrational. Because if anything in 2014, women do a heck of a lot more than men. I mean, if you just think about it, they work outside of the house 90% of the time. They're primary caretakers for the house, for children, and the elderly. And it's not good if you can't focus. And then because you can't focus, you go to the family practice doctor. Do you know 85% of psychiatric meds are prescribed by non-psychiatric physicians? Yeah. So you go to the family practice doctor who knows nothing about ADD, and he puts her on Lexapro, or Celexa, or Prozac, or Zoloft, or Paxil. He's raising serotonin. Well, you know what happens when you raise serotonin? Is it drops your frontal lobes. Serotonin and dopamine counterbalance each other in the brain. So if you raise one, it lowers the other. So all of a sudden, I have this woman who has low frontal lobe function. Now the doctor puts her on something that lowers it further. I had this one great story. I almost told it on public television, but they told me I couldn't. So this woman, this is exactly what happened. She's overwhelmed and stressed by her life because she has inattentive ADD. The family doctor misdiagnoses her as depression, puts her on Prozac, and within a couple of days, she's feeling better. She's like happier, and she just doesn't care if she's anxious anymore. And like a week later, she's even better still. She's just totally going with the flow. And then 2 weeks later, she's at a stoplight. And a guy pulls up in a pickup truck next to her. And the guy winks at her, which is not unusual because she's a pretty woman. But what happened next was really unusual. She unbuttoned her blouse and showed the man her breasts. And then her frontal lobes finally kicked in because she was the wife of a pastor. She's like, what is the matter with you? And she speeds off as this poor man who thinks he's just hit the jackpot tries to follow her. At which point she came to see us, and when we looked at her brain, it was low. And what the doctor had done was disinhibited her. So what we do is really important. If we get your meds wrong, you can go to jail. You can get divorced. You can lose your money. You can lose your kids. This is really important. I don't know. I should be able to tell that on public television, don't you think? They have fewer behavior problems, but they have low frontal lobe function. So when I first started doing imaging, I just fell madly in love with it. And I scanned everybody I knew. I scanned my wife, I scanned my children, I scanned my mother who had a beautiful brain, scanned myself, actually horrified myself. And then it was 6 years later, my middle child, my oldest daughter, Brianne, I could tell she was really struggling. In fact, she has a hyperactive little sister. I always tell people I know more about ADD than I want to know. Caitlin was hyperactive from before birth. She was so active inside her mother's womb, we thought she was going to be a boy. Trying to hold that child when she was a year old was like trying to hold a live salmon. Did you ever see children on little yellow leashes in the mall?
Yes.
She would have been one of those kids, except I wrote a column for the local newspaper where I lived, and so when I'd go to the mall, people would recognize me. And so what I used to do with Caitlin was put her in the stroller and tie her shoes together so she couldn't get out. Now, her older sister, always easy, always sweet, but the truth is I never thought Brianne was very smart. And it breaks my heart when I tell you that, but that's what I thought. And I'd have to teach her the times tables like over and over again. She really didn't learn them till the 5th grade. I'm like, something's not right. And so when she's in 3rd grade, I had her tested by a neuropsychologist. And the neuropsychologist told me she wasn't very smart. Now, she didn't use those words, but I looked at the test. And she tested with an IQ of 90, and she said, she's in, a family with you, and you're a high-performing person, so that's what upsets you. And I'm like, no, it's not that. And she said, Brianne will be okay because she works so hard. And in 8th grade, she actually won a Presidential Scholar Award, not for academics. This child had never gotten 1 A in her life. It was effort. And that's just a child you love, right? I mean, she's doing her best all the time. But now it's 10th grade. She's in a college prep school. And she's staying up every night till 1 or 2 o'clock in the morning to get her homework done. And you just see she's getting depressed. And I'm helping her as much as I can. And one night, it's after midnight, and she's trying to get her brain around genetics. And she's crying, and she says, I just don't think I can be as smart as my friends. And it broke my heart. So the next day at work, I pulled up her original scan. See, the original scan, I'd had the eyes of somebody who'd seen 50 scans. And now I'd seen 5,000 scans. And when I looked at it, I was horrified because it was really low in activity. And I'm like, how'd you miss that? And so I had her come in the next day, we scanned her again, and that was her brain. It was awful. I cried. Because I was helping all these other kids and not her. And of course, parents never have favorites. But she was mine. I mean, I was just bonded to her. And so I said, sweetie, I want to do one more scan on medicine. And she goes, medicine? I'm not taking medicine. I'm not like Caitlin because, you know, ADD siblings are at war with each other. But I'm a child psychiatrist. I know how to get my way with kids. I said, sweetheart, this is really important. What'll it take? A phone line in my room.
Those were the days, right?
And I'm beginning to think, she's smarter than I thought. That was her brain the next day. And what was exciting to me is I knew she had a brain that could respond. That was exciting to me. In fact, I took her to dinner a week later, just her and I. And I'm like, so how's it going? She's like, oh my God, Dad, you can't believe the difference. She said, a 2-hour class, they had block classes, would seem like it would go on for 8 hours. And I was always very religious. I'm like, what? She said, as soon as the class started, I'd pray to God that the teacher would not call on me. Because I was lost. I was just always lost. She said, now that same class just seems like it goes by in 20 minutes, and I like it because I can learn. And she said, I want to be a geneticist. I'm like, what? She said, Dad, I can see the DNA molecule rotate in my head. 3 months later, straight A's.
Oh, wow.
What medicine?
The next 10.
I love Eric. Yeah. Are you selling it now?
The next 10 years, straight A's. Brianne got into the best veterinarian school in the world. So what would her life have been like if we wouldn't have bothered to look at her brain? That we would have, in fact, condemned her to a life of mediocrity. I don't want that for her. I don't want that for you. I don't want that for the people that you love. But how do you know unless you look? So, it's the same plan. You boost dopamine. It's not that hard. So stimulating supplements or meds, a higher protein diet. The medication for her initially was Ritalin. Then we switched it to just very low dose Adderall. Made a huge difference, along with exercise, fish oil, and the right diet. And it has made a humongous difference for her. But not everybody's like that. There's this other type that I discovered called overfocused ADD. The problem is not that they can't pay attention. The problem is they can't stop paying attention. It's they can't shift their attention. They get stuck on negative thoughts or negative behaviors. So they have trouble shifting their attention. They get stuck into loops of thinking. They have both low serotonin and low dopamine. Too much activity where the arrow's pointing, that's called the anterior cingulate gyrus. It's such an interesting part of the brain. A lot of research on it. It's involved in shifting attention and error detection. So when people have too much activity there, they're noticing everything they hate about themselves and other people. So that's the brain's gear shifter.
Can we go back? Or is this in our handouts or anything?
It's in my new book, Healing ADD, which you totally should get. It's awesome.
I have the old one.
I hear
I
it's
think we
really...
should get the new one.
The old one's awesome too.
Okay.
And the old one has this.
Okay.
So what does the cingulate gyrus do? Basically, it shifts attention. It goes from task to task, help you move from idea to idea, be flexible, go with the flow, and it lets you know when something's not right.
So what does it mean with the arrow on the brain?
So that's where it's pointing to that part of the brain that's called the anterior cingulate gyrus. So just think it's pointing to the gear shifter. Like the gear shifter in a car is right in the middle, that's right in the middle. And so overfocused ADD is people get stuck. See, and if you get stuck on things, it looks like you can't pay attention. So we've already talked about 20 or 30 things, but if I said something like half an hour ago that irritated you, well, now you've thought about it 14 times, which prevents you from paying attention. So part of attention is shifting attention. So you worry, you hold grudges, things don't go your way, you get upset. And on the surface, it appears selfish. But it's really not selfish. It's rigid. It's easy to judge the kids as bad. It's a little more sophisticated to go, I wonder why. They tend to be argumentative and oppositional. Their first word is no. Their first short phrase is no way. Their first complex sentence is, you can't make me do it. Even if you ask them to do something they want to do, they'll say no. And they see too many errors. So there's always something wrong. Always something wrong. And they also have family members that get stuck on things. So holiday dinners can be a whole bunch of fun.
What did you mean by that last statement, family member? I mean, meaning...
So if you have an overfocused ADD child,
right,
odds are maybe dad has the classic ADD and mom is worried, rigid, and flexible, and if things don't go her way, she gets upset. Or mom comes from an alcoholic family and grandpa's like that. So you can see the holding grudges that can go through generations. You can see the addictions. You can see people who they just get stuck. And on, over and over, the same thing. I discovered this type in children and grandchildren of alcoholics. So when I see this type, I'm looking for a family history of addiction, especially alcohol. Because what alcohol does is it calms down your brain. You feel better. You're stupid over time, but you feel better. So what do you think if we have a classic ADD husband who's married to an overfocused ADD wife? So this is actually my first couple. It was in 1991. I saw a little boy who had oppositional defiant disorder and ADD, and his little sister who had inattentive ADD. And the little girl got better on some medicine and some supplements, and the little boy was not getting better. And so I decided, well, he's not getting better. Why? So I would see him, and I realized his mom and dad hated each other. And it was the chronic stress in his family that was preventing him from really getting well. And so I was young and a lot more naive then, and I'm like, well, I'll just see them and fix them. And so I suggested they see me for marital therapy. And they said, you know, Dr. Amen, we really like you. We've tried this 4 times, and it didn't work. And I had this very dumb thought in my head. Well, maybe they just didn't see somebody good. Never think that. It's always the sign of narcissistic, I don't know. It's a bad sign. So anyway, so I saw them the first time. And I had 2 couches in my office. They sat on the opposite end of each couch. It's a bad sign in marital therapy. This woman had a PhD in grudge holding. Oh my God, she would beat things to death. In fact, one day I'm thinking to myself, she's not going to beat it to death. She's going to beat it into the afterlife. I mean, she's like holding on to something her mother-in-law did 15 years ago, and she just cannot like let it go. And she's married to a guy called the Sniper, because he was always late to the sessions. And whenever she would sort of like settle down and be in a teachable place, he would say something so mean, so nasty, just to get her going again. And so he's conflict seeking. She can't let anything go. I'm like, and after about 4 months, I hate these people. And the reason I hate them is I know I'm not going to get them better. I feel hopeless. And at the end of 9 months, I'm still seeing them. I'm persistent. I'm in the shower getting ready to come to work, and I realize they're on my schedule. And my stomach started to hurt. And I'm like, these people are in my shower. Today I'm going to tell them to get divorced. Because being raised in chronic conflict is bad for children. Divorce is bad for children. Being raised with chronic conflict is worse. And so I'm going to tell them to get divorced. How many of you grew up Catholic? Anybody like me? So I grew up like, no kidding, Catholic. My mother was serious. Hell, purgatory, the rosary. I was an altar boy till I was nearly 19. I was almost going to be a priest until I realized I was going to be called Father, Amen. I'm like, that's not going to work. But only the Catholics will understand what happened next in the shower. The Catholic voice in my head started to yell at me, "What? Because you're not a good enough therapist. You're going to tell them to get divorced and damn their eternal souls to hell." And I'm looking at the water faucet like, how much therapy do I need to get over this? And I got out of the shower, I called Jack, the guy that owned the imaging center, and I said, "Jack, will you give me 2 scans for the price of 1? I was always negotiating with Jack. And he's like, "Why?" I said, "Jack, I have this couple and I can't figure them out and I'm very frustrated." He said, "Couples? You want to scan a couple?" He said, "How interesting. You know, I've been married twice. I can't figure it out. Maybe we could have a business and call it brainmatch.com. So anyways, he had really low frontal lobe activity. She had a really hot cingulate. Just the night before, if you believe in random chance, I don't, but if you believe, in the American Journal of Psychiatry, so the medical journal I read, Prozac calms down the cingulate gyres. So I put her on Prozac, him on Ritalin, and I told him I didn't want to see him for a month because I had to like recover. And when they came back a month later, they sat on the same couch. She had her hand on his leg. Wow. She stopped beating things to death. He stopped being a jerk. He had focus. She could shift. This is what, 23 years later? Last year I did a conference in San Francisco. They showed up. They're still married. They like each other. They don't have to see more therapists because when your brain works right, you work right. And when your brain doesn't, you have trouble. So overfocused. We use medicine or supplements to boost both serotonin and dopamine. They don't do well on a high-protein diet. In fact, I was on the Rachel Ray show, and I was explaining this to Rachel, and she's the overfocused type. I said, put them on the Atkins diet. They get mean. She's like, oh my God, that was me. I went on one of the low-carb, no-carb diets, and I was so mean. I wondered why my husband didn't leave me. So get on the wrong diet for your brain. It can cause serious problems. So we make something called serotonin mood support and focus and energy. So in this type, we use them both. Or they, from a medicine standpoint, they might respond to a combination of Prozac and Ritalin or Lexapro and Adderall. It's a masterful combination. I tend to start with natural supplements. Why? Because you never have to tell an insurance company you're taking them. It doesn't negatively affect your insurability. And it works when you target them properly and they have fewer side effects. I generally try to stay away from serotonin drugs because 60 to 80% of them have sexual side effects. And I'm just a big believer in physical love. That if you drop out someone's libido, you've just increased the chance they're going to get divorced. And I'm not a big fan of that. And then the next type, I described this one very early. It's called temporal lobe ADD. So they have all the ADD symptoms, plus they have problems with what the temporal lobes do, learning, memory, temper control. So let me tell you about Chris. So this is in that first month. I'm ordering scans. I'm getting really excited about it. And I'm a child psychiatrist, so I also admit kids to the child unit. And I'm on call one weekend, and Chris had just attacked another kid at school with a knife. And this is his 3rd psychiatric hospitalization for violence. He was put on Ritalin at the age of 6, he started to hallucinate on Ritalin. In my mind, look out for temporal lobe problems if anybody's hallucinating on Ritalin. Then at the age of 9, he attacked somebody else. They put him on an antidepressant. It didn't work. Now he's been in psychotherapy for the last couple of years, and the therapist blaming the mother, as psychiatrists tend to do. If only you would get in therapy and deal with your own childhood issues, this kid wouldn't have a problem. So it's under that setting, Chris attacks a boy at school. He ends up in the psychiatric hospital on a Friday night. I'm on call. And I meet him, and he's a nasty boy. And on Saturday morning, I'm the one on call. I grab all the kids on the unit, and we go outside and we play touch football. And every single play, this little monster cheated. I mean, he would just like take the ball, at the end of the play, take the ball and move it, and then turn and look at me like, what are you going to do about it? Are you going to yell at me like my mother yells at me? And in my mind, I went, I'm not going to yell at you. I'm going to scan your little brain and find out why you act like this. And what we found was both of his temporal lobes were terribly low in activity, and his frontal lobes were like, he's 12 years old. It's like, why does your brain look so awful?
You want smooth, right?
You want smooth,
No
full,
holes.
no holes. What the holes mean are areas of serious low blood flow. So, and because it was low in the front, I understood the ADD, because that already been published. I didn't make that up. It was first published by Hans Loo from Denmark in 1984. Alan Zemeckis from the National Institute of Mental Health published a study in 1990 saying the same thing. So I have science behind this, but what I didn't know is, what does low temporal lobe blood flow mean? And so I went to the library. You still had to do that. You couldn't look it up on your phone, right? I went to the library. We pulled a Medline search. Low temporal lobe activity on SPECT is associated with seizure disorders. And I'm like, huh. So I put him on Tegretol, which is a really good anticonvulsant. And on Tegretol, he became the sweetest boy you would ever want to meet. But he was still struggling in school. So then I put him on Cylert, which was a stimulant. And that combination was a miracle for him. All the aggression went away. He didn't need psychotherapy. His mother didn't need psychotherapy. Now, I'm a huge fan of psychotherapy, so don't imply that I don't like that. But that wasn't the problem. The problem was his brain was broken. And when we fixed his brain, he could now thrive in school. And I remember so excited, because, you know, before imaging, I didn't have those kinds of miracles. And I like miracles. You know, I grew up Catholic, right? I mean, we believe in miracles. 5 years later, I got invited to his school. So now he's a senior in high school. And when I walked on the campus, he didn't know I was coming, but he saw me. He runs over, gives me a big hug, and introduces me to 5 of his friends. Now, what do you think would have happened to Chris if we wouldn't have looked at his brain and targeted treatment specifically for him? He'd have been in jail, or a residential treatment facility, or he'd have killed himself, or somebody else. How do you know unless you look? And I think these cases were planted so that I would do this work. It's the thing that really irritates my colleagues. You know, having a really deep sense of meaning and purpose. It's like, well, that can't be science. We have 2,800 scientific references on our website today. There's a lot of science, but someone has to have the passion to put up with the nonsense of, oh, this isn't real. No, this is real. And those of you that have scans, they're your brain. It's really how your brain looks. So, we use supplements or medicine to boost GABA and stabilize the temporal lobe, then dopamine to help focus, in that order. And we use a high-protein, healthy fat diet. All right. The next type is what we call limbic ADD. It's sort of where these are the glass half-empty people. Like they have a low-grade depression. Their limbic brain tends to work too hard. Sad, negative, glass half-empty. Poor appetite. They're more socially isolated. And so we use stimulating supplements or medications that also help mood. So the two I like, from a supplement standpoint, we use SAMe and EPA fish oil. From a medicine standpoint, we'll use Wellbutrin along with EPA fish oil. And then the last type, and it actually took me 6 years to describe this type because I have to tell you it didn't fit my worldview. I thought ADD was low activity in the frontal lobes, this was high activity. But I kept seeing it so often, and they were the worst cases of ADD that I went, okay, uncle. This is actually Joshua's brain. Josh was a really interesting kid, got arrested 10 times for violence, but only when he drank. And so I got the judge to let me scan him sober, and then I got him to let me scan him drunk. Where I actually got him drunk, just like he got drunk on the night of the crime. It was so stinking interesting. Like right in the middle of getting him drunk, he's slurring his speech, and he's like, Dr. Raymond, it's the weirdest experience of my life. I'm like, why is that? He said, my doctor is getting me drunk, and these goons are watching. These were prison guards. And when he got drunk, calmed down the ring of fire. It's called a ring of fire because all the red, it's overactivity in the brain, not underactivity. These kids, they have all the ADD symptoms, in fact, like all 18 of them. They're moody, easily distracted, too many thoughts, overly sensitive. And Jarrett's one of those kids. He was diagnosed with ADD at the age of 2. Wow. And by the time I'd seen him at 12, he had failed 6 stimulants. He'd failed antidepressants, he'd failed, they were just getting ready to put him on an antipsychotic when the mother went, time out. I don't want to do that. She brought him to the Amen Clinic. And when we scanned him, his brain's on fire, poor kid. And they're stimulating it over and over. It's like, why aren't the doctors learning that these make him worse, not better? And on Neuralink, which is the supplement we make, boosts GABA, 5-HTP, so serotonin, and L-tyrosine, along with fish oil, he became like the normal, sweet kid. I mean, it's really awesome. He's been 3 years now on the honor roll. So
no drugs with that child?
No drugs. We like that. Those are our favorite cases, no drugs.
But Neuralink is a really good.
Neuralink is a really great
phenomenal
supplement for the right brain. They have to be targeted to the right brain. So I'm always thinking, is it early bipolar disorder? Is it allergy? Some form of inflammation? So we'll often start them on an elimination diet to see if there are any allergens associated with it. We use supplements or meds to calm the brain, GABA and serotonin. I particularly like Neuralink. And then the last type that I described in the revised version is anxious ADD. And these are kids who are both anxious and ADD at the same time. Anxious, nervous, tense. They predict the worst. They don't like timed tests. They freeze when they have to talk in front of the class. In fact, they would rather get an F in a class than get up in front and give a talk. We use deep relaxation, meditation, boost GABA and then dopamine. Stimulants alone usually make them more anxious. So these are the types. Classic, what you usually think of when you think of ADHD, hyperactive, restless, impulsive, can't concentrate. Inattentive, think of the spacey girl. Overfocused, the argumentative child that gets stuck on things, or adult. All of these apply to adults. Temporal lobe, which can be temperamental, learning problems, limbic, sad, ring of fire, oh my goodness, and anxious. Questions?
So are these while active brains or inactive brains at rest versus?
So these are mostly concentration brains. But it's the same sort of pattern, except do they deactivate or do they activate? In fact, if you deactivate and you have the ADD symptoms, you have about a 90% chance you're going to respond to something stimulating. If you activate, you have about an 80% chance stimulants will make you crazy. Yes?
What if you have a child that's multiple, like you said, but with some of the supplements, you did the GABA first and then the serotonin, where do you figure out?
So here are the
which to go
rules.
first?
If you have more than one type, ring of fire and temporal lobe always get treated first. So you have to start with GABA. Because if you start with serotonin or dopamine, you can make them worse. So we always err on the side of protect the brain. And then the next thing you do is the next most important symptomatic thing. It doesn't matter. Yes, sir.
Do kids' brains evolve so that you're doing the scan, it's a snapshot, you start to treat, and if the treatment goes well, then you don't have to worry. But is there a risk that it might evolve and they need to be scanned again? I mean, I'm just thinking, as part of growth and everything. I just
Yeah, no, it's a great question, because your brain goes through wild development. So what we see normally, little kids have very, very busy brains, but there's a process in the brain called pruning, another one called myelinization, where the brain tends to settle down over time. And so if I scan a 6-year-old, his brain is likely, normally, to look different than when he's 15. Now, we know a lot about what a healthy 6-year-old brain looks like and a healthy 15-year-old brain, but things do shift over time. And the advent of hormonal changes can clearly make things much worse, right? For girls or for boys. And the same thing's true with menopause. Can make things, or andropause, can make things better or worse. Yes?
I have a question about the test. I'm a counselor, marriage and family therapist, and so I have recommended people to take the scan and sent them to different of your organizations. And I was wondering about when people have the test and you have to give an injection of, what is it, the ink, whatever goes to.
It's not a dye.
Dye.
It's not a dye.
Not a dye.
They say they don't have allergic reactions to
Okay,
it.
that's what I wanted to ask, because, if I sent them to do that, I wanted to make sure that they're not allergic to.
Yeah, no, it's called a radioisotope. We've done just about 90,000 of them. We've not lost anybody, so we're pretty happy about that. Yeah, so it's pretty easy. The hardest part of the procedure is a little tiny butterfly needle into a vein in your arm. That's the hardest part of the procedure.
And how long does it take to be processed into your body?
We have our patients drink about 32 ounces of water. It cuts their radiation risk in half. So the level of radiation you get from a SPECT scan is about the same as a head CT. So it's a normal medical amount of radiation. It's about a third of an abdominal CT if they CT'd your belly. But we have them drink water and it gets it out faster. It's gone in a day. I'm not going to go through all these. Just if you're interested, it's all in the book. That's a really interesting story. But I want to tell you about what we did with this, because I want to just tell you how excited I am about it. Come on. So I noticed someone was here from the Salvation Army. I have a stalker. Her name is Lori Heiselman. I love her. So she got really excited about my work and about brain health. And in fact, I think maybe I have her picture. And there's a reason I want to share that story with you. Oh, where is it?
Now, do you have ADD yourself?
I don't.
But your kids do.
Yeah, they totally got it from their mother.
It's very inheritable, right?
It's very inheritable.
It's like addiction.
So I gave a talk recently, and I talked about this concept. If you get this information about brain health and you put it in your life, and then you give it away, you get to keep it and change the world. So Lori, who I was telling you about, she's the director of one of the Salvation Army's largest drug treatment programs. And it's in Anaheim. And she just started coming to every lecture I gave. I mean, it's like, there's Lori. And she works for the Salvation Army, and you know they're always trying to take money out of your pocket. And so she's getting me to donate like lots of information and product, and I just loved her. But then she really got it. And what she realized is that physical health and mental health are connected to each other. And so we have, coming up, June 20th to the 22nd, our brain-body turnaround. So she took that, like, I don't know, a year and a half ago, and just totally fell in love with getting well. And so you see, she went from not being healthy to being really healthy. She dropped about 60 pounds. And Lori's like 4'11". So that's really a big deal. And as she got well, her husband got well, her children got well, even her grandchildren. So this is Lori and her grandson both drinking a green drink. They start their mornings with a protein vegetable shake. Those of you that start your morning with fruit shakes, stop it. It's too much sugar, right? Put a half a cup of organic frozen blueberries, that's fine. But then kale and spinach and protein powder, little stevia, it'll satisfy you and it will start healing you. So she does that. Then what she realizes, because she's the director of a large drug treatment program, that they are in fact feeding their beneficiaries like crap. And now she gets convicted. And it's like, you know, I'm either in or I'm out. And she's like, okay, I'm in. And she completely, radically changes the program. So she adds great food, she adds exercise, they're learning about brain health, and the exciting thing is so many, these are a lot of the patients there. They had been diagnosed with ADD as children, and now they say the brain fog has lifted. That they couldn't pass their GEDs and now they're passing them. Their recidivism rates, their relapse rates are better because now they have better judgment, because what's the organ of judgment? It's your brain. And so one of my favorite stories is Thomas, who was a gangbanger, who came to the Salvation Army from jail, who had lost his 6 children, who hated himself, who'd failed his GED 3 times. He said, I was depressed, negative, every bad thought you can think of. I thought I was stupid, I had brain fog, so I had nothing to lose. So he just threw himself into the program. And after 8 months, he had lost 85 pounds, got his GED, and he wrote Tana and I, my wife, a letter and said my life was a mess, and now it is a message. I have been tested. Now I have a testimony. I was a victim, and now I am victorious. I went through trials, and now I am triumphant. And that's what I want for you. I want you to fall in love with your brain, to do the right things for your brain, to know what type of brain you have, and to develop this concept I call brain envy, and then share it with people that you care about. Questions?
What do you think about the growing body of research coming out about the use of probiotics to treat psychiatric patients?
I'm a huge fan. You know, I think the bugs in your gut often determine the health of your brain. So your gut actually makes more neurotransmitters than your brain. And if your gut's not right, and it's not right if you had a lot of ear infections as a child and they wiped it out with antibiotics. It's not right if you have a high sugar diet because sugar feeds the fungus in your brain, in your gut. It's not right if you eat a lot of allergens, if you happen to be one of the unlucky 7% that's sensitive to gluten. You end up with this leaky gut syndrome and your whole body can become inflamed. Inflammation's the major cause of Alzheimer's disease and depression.
So will we be expecting to see more from you about recommendations of certain types of probiotics?
Yes, we're actually working on our own brain-directed probiotic now. Yes, sir.
Have you been much with sleep disorders? Sleep apnea, like, and the effect on the brain?
You know, we have done a lot with sleep disorders. If you sleep less than 6 hours a night, you have lower overall blood flow to your brain. Sleep apnea makes your brain look like you have Alzheimer's disease. In fact, we often are sending people to sleep labs, and what often happens is guys will get diagnosed with sleep apnea, they can't get used to the mask, and they throw it away. And we really get after them, go back to the sleep lab, get them to work with you until you feel comfortable with it, because if your brain doesn't get oxygen, do you know your brain is the most metabolically active organ in your body? And it's 2% of your body's weight, but it uses 20 to 30% of the calories you consume, 20% of the blood flow, 20% of the oxygen. You can't deprive a metabolically active organ of oxygen without damage happening to it. Yes, ma'am.
Actually, two questions. One is, where would you go for research on recidivism with, you mentioned lower recidivism in I work in a drug treatment program, dual diagnosis patients all the time. I see this all the time.
You know, we
Diet is-
haven't published this yet, but David Admire, so I would look up David Admire's work. He actually put in a screening program into the courts here in Redmond, Washington, and cut recidivism from 69% to 29%. That'll blow you away.
Yeah.
For every dollar they spent on the program, it saved the state of Washington $7. Now, of course, did the bureaucrats pick it up and start implementing it? Of course not, right? Because we're not interested in doing anything except maintaining the status quo. But
Second really quick question, bipolar ADD, teasing them out.
you know, I actually don't find it that hard.
Yeah.
So let me help you with it. People who have ADD all the time. It's not, you know, they have it this year and they don't have it next year. People have bipolar disorder, my experience, they have normal times, and they have down times, and then they have up times. The ring of fire, why it's ADD and why it's not bipolar, is they're that way all the time. It doesn't go through wild fluctuations. And I think we diagnose bipolar disorder in children, and I know exactly where it came from, and it's a scandal. I think it's made up. It's, you know, I mean, the first thing you should do is put them on an elimination diet. The second thing you should do is scan them, because a lot of the, quote, bipolar kids are head trauma kids. They fell off their bicycles, they fell out of a tree, they damaged their temporal lobes, and now they have mood instability, irritability, temper problems. We're diagnosing them as a lifelong mentally ill person with bipolar disorder, and they have something that may, in fact, could be rehabilitated with the right treatment. How do you know unless you look? And the fact that, you know, we don't look on a wholesale basis. I mean, what I'm showing you, and I'm absolutely convinced, I'm showing you what psychiatry is going to be like 25 years from now. Our major goal is to make it 10 years from now, not 25 years from now, because too many children are hurting. I think anybody who goes to prison should be scanned. I think anybody who goes to residential treatment should be scanned. I think anybody who turns 50 should be scanned. My doctor wanted me to have a colonoscopy. I wanted to know why I didn't want to look at my brain. Alzheimer's disease starts in your brain 30 to 50 years before you have any symptoms. If a train is coming to hit you, well, don't you want to know so you can step out of the way?
I was going to ask a question right along that. What is the progress of peer review and acceptance of psychiatric imaging?
There's a great article called the Triangulating Perspectives on Imaging. It was done by Judy Isles at the University of British Columbia. So she talked to like a dozen university researchers who hate the idea that people like me are doing it clinically. And then she talked to about a dozen of us who do it clinically. And then she talked to 28 patients that she recruited through the web, through advertisements and so on, who's had imaging. And it's really an interesting paper. I'm happy to send it to you. Everybody thinks it's a good idea. They're waiting for the gold standard perfect study that never will exist, because that's not how studies get done. On our website today, we house 2,800 scientific abstracts on SPECT and anything you can imagine that people have done. And so my perspective, as it has been for 23 years, is you have to be kidding me. Without imaging, what do you do? Is you do 1840 medicine, where that's how they diagnosed Lincoln in 1840 with depression. They talked to him and looked at him. We have to do so much better. But the coolest part of it was the patients. The people who had been imaged in my clinic or in our clinic or another clinic, 89% of them said it was a valuable experience. And 80% of them said they'd do it again. And they said, it made me feel like I was not crazy. It made me feel like I had control over my own health, which is exactly what we're excited about. But there's still people who think I'm of the devil. I got interviewed by 2020, and the interviewer talked to me about, which is funny because now Brad Peterson's a research colleague of mine. We're working on a paper together. And Dr. Peterson had said he thought I should be arrested for what I do. And the reporter wanted to know what I thought about that. And I smiled and I said, last week somebody told me I should win a Nobel Prize for this work. This week they want to arrest me. It sort of keeps me even. It's a very exciting time. I see the tide is turning. I met with the Surgeon General of the United States Army over the summer. She's excited about it. We're doing demonstration projects at Fort Carson and Fort Campbell. We can distinguish between PTSD and TBI 96% of the time. It's like, without imaging, how do you do that? You're doing the whole Karnak the Magnificent, and our outcomes in psychiatry have not improved in 60 years. So Ritalin was released into the United States in 1954. We have no better medicine for ADD. And the studies show it doesn't work long term. Imipramine was released in 1959. We have no better antidepressant. None that work better than imipramine. Thorazine was released in 1954. We have no better antipsychotic. We suck, sort of as a profession. We can do better.
Do you think, what can be done to lower the cost so that it could become more mainstream?
Well, I think what we need is advocates to go after insurance companies. And I had an exchange this week with Bruce Cuthbert, who is the director of imaging at the National Institute of Mental Health. And I'm always irritating those people. I'm like, did you see the study? We just published a new big, huge review on SPECT and TBI. Did you see this study? And he wrote me back and he said, we're all excited about the possibility. But until insurance covers it, we can't put money into research. And I'm like, that's backwards. If you don't put money into research showing that it can demonstrate it, then they'll never cover it. It's like you're setting it up so it won't work. Now, I said that in a very polite way to him, but I'm like, are you kidding? So, anyways, I know there are other things happening tonight. There's a raffle, there's a tour. Are you ready? Come. This is Leslie. Leslie is our marketing director, our corporate, clinic outreach
coordinator,
something.
Thank you very much,
So,
Dr.
thank you. It's been my pleasure to be with you.